Thank you for the invitation to speak at the Virtual Institute for Rehabilitation Payment Models. My name is Ann Deitch, and my presentation in the next 15 minutes will focus on the institutional post-acute care quality landscape. In terms of the topics I'll cover, they include the Centers for Medicare and Medicaid Services Quality Reporting Programs for Inpatient Rehab Facilities, or IRFs, the Long-Term Care Hospitals, LTACs, and as well as skilled nursing facilities, or SNFs. I'll also touch on the skilled nursing facility value-based purchasing program, and I'll wrap up talking about the Center for Medicare and Medicaid's 2022 National Quality Strategy Goals. So to begin with, the quality reporting programs were established through various statutes, including the Affordable Care Act of 2010 that established the IRF and LTAC quality reporting programs. The Skilled Nursing Facility Quality Reporting Program was established under the Improving Medicare Post-Acute Care Transformation Act of 2014, also known as the IMPACT Act. The IMPACT Act also required the submission of standardized data and quality measure data for all post-acute care settings. There's 3 data sources that are used to calculate quality measures in the institutional post-acute care settings. Those include claims data. A second source is the Center for Disease and Control and Prevention's National Healthcare Safety Network, also known as NHSN. And finally, a major source of quality measure data include the patient assessment data, which are on setting-specific assessment instruments. In the IRF, the assessment instrument is called the IRF-PI, the Inpatient Rehab Facility Patient Assessment Instrument. For LTACs, it is the Long-Term Care Data Set, and for SNFs, it is the Minimum Data Set 3.0. I'll begin talking about the Inpatient Rehab Facility Quality Reporting Program. The Inpatient Rehab Facility Quality Reporting Program includes 5 measures focused on patient safety and care coordination. On this slide, I show them, and they are from the data collected through the IRF-PI. They address topics like falls with major injury, pressure injury, ulcers and injuries, drug regimen review, as well as the transfer of health information to patients, as well as to other providers. A second set of measures related for the quality reporting program for IRFs focus on motor function, and one is a process measure, and 4 are outcome measures focused on mobility and self-care. Additional measures are from the NHSN, which focus on infection and preventing infections. There's a total of 4 measures. They address the outcomes of catheter-associated urinary tract infections, C. difficile infections, as well as 2 focused on vaccination of healthcare personnel for the influenza and COVID-19. The final set of measures for the Inpatient Rehab Facility Quality and Reporting Program include claims-based quality measures focused on readmissions, discharge to community, as well as Medicare spending per beneficiary. In terms of the future of the IRF Quality Reporting Program, in the most recent proposed rule, CMS mentioned their interest in working on a cross-setting function quality measure, health equity measures, as well as a COVID-19 vaccination coverage measure for patients. They also expressed an interest in requesting information for digital quality measures focused on the C. difficile outcome measure, and also had a request for information about disparities in healthcare quality. Now moving to the LTAC Quality Reporting Program, the same set of safety and quality care coordination measures are also that were included in the IRF Quality Reporting Programs are included in the LTAC Quality Reporting Program, again covering falls and pressure ulcers, as well as transfer of health information and drug regimen review. The LTAC Quality Reporting Programs include some LTAC specific quality measures that focus on patients requiring ventilator care, including a spontaneous breathing measure, which is a process measure, a ventilator liberation measure, which is an outcome measure, 2 process measures for function, and a change in mobility measure. There are also 5 NHSN measures that are included in the LTAC Quality Reporting Program, the same 4 that were included in the LeaRRn program, as well as an additional one focused on central line associated bloodstream infections. The LTAC Quality Reporting Programs includes 3 claims-based measures focused on readmission, spending, and discharge to community. Similar to the LeaRRn, the future of the LTAC Quality Reporting Program includes additional measures under consideration, as well as digital quality measures, requests for information, and disparities in healthcare quality requests for information. The Skilled Nursing Facility Quality Reporting Program is next, and again focuses on patient safety and care coordination, the same measures that are in the LeaRRn and LTAC Quality Reporting Program. There are also measures that are aligned with the LeaRRn function measures, 1 process and 4 outcome measures focused on self-care and mobility. For the NHSN and claims-based measures, there's only the COVID-19 NHSN measure for the SNF Quality Reporting Program, and the 4 claims-based measures in this program focus on discharge to community, spending, preventable readmissions, and 1 focused on healthcare associated infections requiring hospitalization. In terms of the future of the SNF quality reporting programs, this year Medicare did propose some new quality measures, including 1 for influenza vaccination coverage among healthcare personnel. They also announced that the MDS 3.0 next release would be released in early 2023, allowing for the submission of the transfer of health information in order for those measures to be calculated, as well as the standardized patient assessment data elements that were required via the IMPACT Act, addressing preferred language, the need for interpreter services, hearing, vision, race, and ethnicity. So those will begin data collection in October 2023. Those standardized items, by the way, are to be implemented in IRFs and LTACs in 2022. In terms of the future of the SNF quality reporting program, they have similar measures under consideration as IRF and LTAC. They also have requested information about measuring disparities in healthcare quality. And CMS has also indicated they have an interest in the CORE-Q, which is an experience of care measure for future implementation, and are requesting information and feedback on that measure. The skilled nursing facility is the only setting that actually has a value-based purchasing program at this point in time. And that skilled nursing facility value-based purchasing program was authorized under the Protecting Access to Medicare Act of 2014 and was recently expanded under the Consolidated Appropriations Act of 2021. The current measure under this program is the all-cause, all-condition hospital readmission measure. And in the future, as soon as practicable, it will be replaced by the all-condition, risk-adjusted, potentially preventable hospital readmission measure for SNFs. Currently, because of COVID-19, the measure is suppressed at this point in time. In terms of the future of the SNF value-based purchasing, in April 2022, CMS did propose the adoption of new quality measures for the fiscal year 2016 program, including the healthcare associated infection measure and the total nursing hours per resident day staffing measure. And again, that's for fiscal year 2026. For fiscal year 2027, they propose the discharge to community measure for skilled nursing facilities. They also requested comment for additional measures for the future of the program, including staff turnover measures and a CDC measure, NHSN measure focused on COVID-19 vaccination among healthcare personnel. Finally, to wrap up, the CMS 2022 National Quality Strategy goals were released in April of this year, and I wanted to highlight them. They include the embedding of quality across the care journey. It includes advancing equity, which, as you heard, is a theme across all of the quality reporting programs. It also focuses on fostering engagement with stakeholders with a focus on person and family-centered care. Another goal is to promote safety by preventing harm or death among from healthcare errors, as well as strengthening resiliency in the healthcare delivery system, embracing the digital age, and incentivizing scientific innovation and technology. And the last goal is focused on increasing alignment to promote seamless and coordinated healthcare. With that, I'm happy to take any questions and pass it off to the next speaker. Thank you.